we have a very special guest. I'm really delighted we have Amy Marshall on, who is a nurse practitioner, but has many other certifications, qualifications, and areas of expertise. She's, can I call you an understudy of Dr. Jerry Tennant? Would that be a fair statement?
Sure.
And now you're carrying the torch for him, because he actually went to New England Mass Eye and Ear when Dr. Trump was there. So they were, so he's no spring chicken anymore. So, but a very valuable individual. I had a chance to meet him down in Orlando and get a picture. But so you've done all kinds of things. You've been in the Air Force. You're at Parkland Hospital, which is of course famous for trying to save JFK's life. You're a nurse practitioner. You started out as a nurse. What did you do in the military? I'm not sure exactly what you did there, but were you practicing as a nurse in that area as well?
Yeah, I was attached to a MASH unit. So we dumped air transportable hospitals on the side of the battlefield and set up surgical suites.
Amazing. And so neural therapy, stone medicine, shamanic energy medicine, low dose immunotherapy, frequency medicine and sound healing, new human bionetic counselor, geometry, home balancing practitioner, all kinds of different things, a treasure trove of multifactorial skills. And of course, every disease is multifactorial. I was just talking to a gentleman who was referred to me by a really good health coach, health trainer. And I gave him 6 more things to work on to lower his glucose. It just gives you the idea of the multifactorial nature of disease. And it's just simply glucose up, right? I just cut carbs. Nope. So many things. So we're really delighted to have you on board today, Amy, and look forward to hearing a little bit about your story and what our audience probably hasn't heard about for the most part in terms of other healing modalities. So with that, please fire away.
Thank you so much. I'm delighted to be here. I feel like it's my soul group here, preaching to the choir. All of those things, that's a reflection of my journey, actually. As I look back on the things that I've been trained in, it's really more of a reflection of my journey and my own healing journey. So I'll touch on that to give an example here in a minute. So one thing I wouldn't leave out is that I did get a ride in an F-16 as an incentive flight for my work in the Air Force. And that's pretty much my only claim to fame.
Well, that had to be exciting.
That was really fun.
Yeah.
Bucket list. So what I thought, I was trying to drive down. I have a lot of skill sets, a lot of things that I could talk about. And I felt like I would take, and Dr. Harshfield was, focus on thyroid. So I got my doctorate in subclinical hypothyroidism. I just conducted a study trying to find and diagnose and treat earlier, because it's such a wave of health misery the longer subclinical hypothyroidism goes. And so that was part of my journey. And so when I concluded that study, basically I was probably somewhere between 40 and 50% of the population are missed just by using the TSH test alone. This is not new information. It's definitely come out in the last 5 or 6 years in a big way. So, but back then it wasn't quite so out. So that's kind of how it started for me. When my own healing journey, I wanted to use that as an example because I think it will be helpful. So I'll start with Dr. Tennant's work and then use the example of my own life. So Dr. Tennant is all about voltage. He calls it voltage, which is another a logarithmic scale for pH. And voltage in the body, as it drops, things show up. So we were talking about oxygenation at the beginning of the call. And when oxygenation decreases because the voltage is low, bugs show up and want to have lunch on us. So, and also pain shows up, many, many things. Your brain stops working as well. So you can dial everything down that we've even talked about and say, what's a voltage donor? What's a voltage stealer? What's a donor? What's a stealer? So mercury is a stealer. A root canal is a stealer. Epstein-Barr is a stealer. So when you can phrase it as simple as that, and then go to work on the things that are the voltage stealers. So as most of us, I'm sure many people know, but I'll start here. We have 6 loops of muscle battery packs in the body, the acupuncture meridians, and they are like semiconductors. They are one-way highways of energy to support the systems of the organs. And that highway is like a battery, right? It's like a muscle battery. And so if we take a battery and we drain its voltage down to 0 from a plethora of things, it actually flips polarity. And so we can put this battery in a rechargeable station. It's not a rechargeable battery, but we could put it in and it won't hold a charge if it's been flipped. So when our polarities flip, and because the voltage is so low, we're dealing with things like cancer. We've gone all the way down, feeling tired, having pain, depression, cancer. So the lower our voltage goes, the more severe the symptoms. So it's important for us to correct our polarities. And like we were saying, how do we optimize voltage? How do we optimize oxygenation in the body? And of course, there's many, many different ways to do that. And more is showing up with regenerative medicine, which is really fun. So if we keep that in mind, the fascia is, we've all seen, taking a chicken breast and you can see the fascia as you're cutting through. So that fascia is so important. And it's the communication. It's the communication in the body. So it's all through the muscle. It's around the muscle casings. And blunt dissection, it's easy to find the loops. Okay. So that's important because the organs are important. So with that little foundation, I'm just going to give you the example of my nosedive and then my healing recovery. So with the birth of my third son, it was a C-section, and I almost died and he almost died. And that was 14 years ago. And it was pretty traumatic in a lot of different ways. And you can imagine the physical and then the emotional, of course, the mental state and spiritual. All states were affected for me. So I lost 3 years of my life trying to climb my way out of this hole. And the symptoms looked like this. So I had my C-section, which went right across the stomach circuit. And my brain kind of took a nosedive, and I was showing signs of depression, which I'd never had before. And my tooth number 14 started hurting. And the fatigue and the hormone imbalance were exceptionally exquisite. Like, I was so tired, I couldn't walk up the stairs. I actually had to walk halfway, stop, rest, walk the rest of the way. So it began, and I remembered actually in this healing moment of mine, I had read Dr. Tennett's book many years before. And I was a nurse at this time, and I knew energy medicine already. And so I would go in for some help. And of course, they just wanted to prescribe Prozac, which is not going to help. It's fluoride based. It shuts down your brain. So after I went back and I reread the book, and I realized that I was dealing with, like you said, multifactorial things. Like, this is more than just one thing going on here. So I went to Dr. Tennant, and he said, "Oh, your spleen stomach circuit is out." And I was like, "What?" And he said, "Your spleen stomach circuit's out." And so I began this learning curve of, what does that really mean? And then I learned that all of those symptoms are on the spleen stomach circuit. So my fatigue, the brain is on the frontal lobe of the brain is on the spleen circuit. My thyroid was on the spleen circuit. Tooth number 14 was on the spleen circuit. On the stomach circuit, spleen stomach circuit on the left. And then I had this huge scar that I needed to take care of with a ton of emotional baggage. So when I came to him 14 years ago and said, I really need some help. I understand what's going on here, but I don't know how to do it. And so he walked me through getting my scars treated. I started my emotional release stuff. I got my thyroid on board. I got the voltage of my body up. I got my polarities corrected. But it still took, 2.5 to 3 years to get my life back. And when I felt better, I went back and got my master's as a nurse practitioner. And then I went and got my doctorate. And then I ccame back to Dr. Tennant many years later and said, "I need to follow you." And all these years, I was like, there's somebody from Iran, somebody from Australia, somebody from Israel, and I could never get in to follow Dr. Tennant. And finally, everything aligned, and I went in there and I followed him for about a month. And he's like, why don't you just come work for me? And I was like, yeah. So that's what I did. So I've been a patient for a really long time. My dad was even a longer patient. So long history with Dr. Tennant, and we overlap quite a bit. So when I went to work with him, I began to help others through these processes. Like you said, it's multifactorial. So with the thyroid piece, if we narrow it down to that, we know that, and I don't know, I'll talk specifics, but I know some of you already know this, but in 1972, they used the TSH test to determine if you had low thyroid, which before then it was just symptom based. So doctors would actually listen to their patients and give them some help. So as time went on, I realized it's more of the conversion of the T4 to the T3, the free T3, and then the component of fluoride competing, lack of iodine, so that the whole functioning feedback loop of the body is basically turned down like a radio, like your thyroid is not getting the information out to the cells. The cells don't have what they need. They can't make their oxygen and they can't work. And the profound thing about the thyroid is that it is every cell of the body has thyroid receptors, every cell. So if you are not optimized, every part of your body is going to feel a bit of a shift downward. That's why it's so important. Of course, all the other hormones as well, but since we're narrowing here, so that began my understanding of how rough it is to have thyroid issues. I call it mean fatigue, actually, because you hit the wall and there's no going forward. That's the mean fatigue. I can't take care of my kids. I have to go to bed. That's pretty mean. Of course, adrenals are in there as well. So it was a struggle for a long time. It was hard on my kids. It's hard on my husband, etc. So as the journey continued, I began to uncover, with Dr. Tennant, with his help, we spoke to Boyd Haley and his work at the University of Kentucky, describing like root canals and how one root canal can decrease your immune system by 70%. And I didn't have a root canal and I didn't have mercury in my mouth, but I did have cavitations in my wisdom teeth. So I had to get tooth number 14 fixed, so pulled correctly with the Hal Huggins protocol. And then I had my 4 wisdom teeth, the cavitations corrected there. And what I noticed when Dr. Evans worked on me is that my fight or flight system actually turned down. So because the wisdom teeth are on the heart small intestine circuit and also your autonomic nervous system. So if you have infections in your wisdom teeth, it's basically turning up your fight or flight. And I see this all the time. If you see some teenagers and they get their wisdom teeth pulled, then like a year later, if not sooner, they're dealing with anxiety and depression. So I had one young girl who came in. She was 18. She just graduated. And as soon as they pulled her wisdom teeth, her stomach circuit shut off. And because it's up at the top, the stomach circuit is right next door to the wisdom teeth. So as soon as Dr. Evans went in and cleaned that one out as well, her stomach turned back on. So the power of dental infections cannot be, it just can't be denied. Can't be denied. So dental infections was a piece of mine. I got one pulled in the military. That was pretty rough. And mine was so bad that it went underneath the tooth in front of it in lung, large intestine. So that's pretty much my weak spot in my body. And I have to address it every now and then. So with energy. So, and then, we talk about scars. Many people have had so many scars, and the worst being ones that have a lot of trauma to them. So people who've almost died in like car wrecks, concussions, and when they've had open heart surgery going right down the center, or they've had a C-section going right across the center. Those are like, in Dallas terms, that's like shutting down I-35, to Mexico and Canada. So when we have these splits in the fascia and of course into the muscle, and then for a C-section into the uterus, you have like literally a physical roadblock of energy trying to make it through those loops. So with neural therapy, I corrected my scars. I help correct other people's scars to get the energy flowing. And oftentimes, if there's trauma in those scars, we've got to work on that as well. So scars is a big piece for a lot of people. Actually, I had a rock hit my head right here when I was in, I don't know, maybe like second or third grade. And I never really bothered to address it because I didn't have stitches. But as soon as we injected neural therapy here, I had flashbacks of the whole bullying incident. So I know emotions are in scars. I experienced that firsthand. And then, like what you're talking about with toxins, we're exposed in so many ways right now. We were talking about, spirochetes and the chemtrails. Who knows what else is in there? I know aluminum's in there. I took my daughter, who was 9 at the time, and I did the oligo scan, which is the spectrophotometry, to see about heavy metals and toxins in the body. And her aluminum was as high as my aluminum. So that's pretty significant. So the ways that I've felt are the safest are homeopathy, of course, like UVB, ozone, and things like that. And then getting the binders in the body to pull it out. So everybody, probably for the rest of our lives, we need to be doing some kind of detox work. That's just my opinion. And then infections, like we were talking about before, I had Epstein-Barr and I had Lyme. So that was also a heavy component energetically on my thyroid. So when I did a lot of rounds of homeopathics and things like that to help with the Lyme. And it was one of the first times I saw Dr. Tennant. He did the what is it called? Dark field microscopy on my drop of blood. Scared the living daylights out of me, because when you wait for 15 minutes and the spirochetes start crawling out the cell, that's a life-changing moment. That's what that's called. And I'm like, what is that? And he said, that's Lyme. And I was like, I don't have Lyme. I have no symptoms of Lyme. And he goes, everybody has it. That was basically his. I was like, oh, okay. So that's okay then. So we went to work on that. I mean, my CD4 was fine. I had Western blots done. They were all fine, but I saw them. So what you were talking about before with kind of these rummaging, these ruminating, these low-lying infections is a real deal. And then emotions is the other piece that we will spend some time with everybody on, because I am almost of the opinion that 85 to 90% of the things that we're dealing with exceptions of like major poisonings, major infections, maybe it's possible that it started with a trauma that decreased the voltage in the body in a certain place where you held it. So if we're talking about thyroid, or we're talking about the throat chakra, and you were a child abused as a child in whatever way, and basically you were silenced, how does that not affect you speaking your truth and living your truth? It does. So, with Eileen McCusick's work and some other people as well, we know that the body keeps the score. That's a book. And so what I've gone to is I've moved to working on the physical body, which I love, but I actually really like going back in time and finding when it started and clearing it, so that the new information that the body has to work with is resonant and coherent. Because all of these things that we're talking about, mercury, Epstein-Barr, dental infections, scars, all of them create dissonance in our field. So whether it's in the body and it's in the aura or the magnetic field, whatever you want to call it. So that has been my forte. I didn't know I was going to be there, but that's where I'm at. I have the ability with sound, and many people do, to find where did it start? Where did the thyroid start going low? For me, it was kind of obvious because it was my C-section, but we know many people who don't have C-sections who have thyroid issues. So it's possible that we all need to be considering our emotional stuff and how we can let go of it. Because it's probably one of the better ways to begin to raise the voltage of the body. And Eastern medicine has this all figured out. They've been doing it for a bajillion years. So I know you mentioned, sound and how does that work? So if you don't mind, I'll take a little bit of a little sidetrack and give you how this showed up in my life, because I think it's important and it might help other people understand and may have had some experiences as well. So I've been pretty intense in the clinical setting for a really long time. And when I began sound and using sound as a resonant frequency to communicate with the body, a couple of things that happened right. Thank you, Marlene. That happened right at about the same time that my dad died. And that, everybody loses loved ones. And all right, we're going off the beaten path here, but about 6 months after he died, he actually showed up at my bedside. And this is all new to me. This is new. I have not studied this. And he basically said, buckle up. You're on the fast track. And I said, I have no idea what that means, nor what this is. And it was in the middle of the night, and it was jarring. But I knew my dad's voice. I knew it. So I knew it was him, and we were very close. I don't usually say this, but, and so what ended up happening over the last 6 or 7 years now, when I've been hands-on sound healing all day long, is people would show up in my room. And, people fly in to see Dr. Tennant from all over the world. So I'm meeting these people from all over the world, or showing up for glaucoma, for macular degeneration, et cetera. And interesting people showed up, and they would say things like, oh, I came across the world. I knew I needed to see Dr. Tennant, but there was someone else that I needed to see, and that's you. And I would say, well, why? And they said, well, we need you to listen to this. And they would give me gifts, or they would give me information about what I began to see and experience. I had no one to ask. When I would see the energy field, or colors, or chords, or dark energies, or intrusive energies, like, what is that? I had nobody to ask. And so finally, I had 2 shamans that showed up in my room, and they began to, they saw it for what it was. I didn't know, actually. I just didn't know. And they began to answer my questions about the energy body. And I said, thank you. Because now I have some answers to work with, because I want to do right by the patient, and I don't want to cause harm, obviously. And so my work with sound became kind of way more involved than just that. And so I have actually taught classes on this, and will continue to do so because people keep asking me to. But the sound is a way to communicate with the information in the body. And you can it's like a biofeedback, but not only is it a biofeedback, but resonant sound is also a treatment. So when we get the body and the organ systems aligned, like a symphony should be, and it's no longer out of tune, and it's resonant, the energy can flow. The energy can flow. So if we go back to the thyroid for a minute, there's some examples I'll give you, if that's okay. I hope I haven't scared anyone away.
We're all here.
Okay, good. Nobody's left yet. Great.
Quite the opposite. This is amazing.
Okay, good. Thank you. I never know what to say, but the angels have said, look, if you need to show up, and I'm like, okay. So that's what I'm doing. So the energy of the throat, we can apply this everywhere. There's different parts of the body that hold different things. But for example, we talk about the thyroid being the speaking of the truth, the living of the truth. Well, what happens if I go out in the field and I look over to the patient and I can see cords around their neck? What am I supposed to do with that? Well, but I know that it needs to go. I know that thank you. I know that it's totally, it needs to go. So that's what I began to work with sound with, of like, let's remove this and see what happens, and put it somewhere, and put it in a crystal, put it somewhere safe. So that's what I began to do. I saw a gentleman who was 21 years old. He came in, and we were working on his heart and his throat at the same time. And he had lost his dad when he was 16 years old. And I'm over there, 3 feet, 2 feet from the body, because our energy field is pretty expansive. And I look over and I see a hand, like a hand of light, just right here where I was working. And I knew that it was his dad who had come back to help us work. And I began to have this awareness of, okay, so there's people who show up to help us. There's ancestors that show up to help us because they're getting healing too. So the energy body is an information gathering field as well as the body. So what it looks like in practice, is, well, I'll give you another example. There's a gentleman who was about in his 70s, mid 70s, and he had flown, I don't know, flown in from somewhere. And I was working out in his field, in his timeline, and it was about 52 years old. And I stopped and I said, sir, something significant has happened at 52. It almost sounds like a life force drop. Sound has a way of communicating. Sound is a way of interpreting. We can interpret sound easily, right? Well, I'll talk about that in a second. And so I kept hitting this in his field and trying to retune it from this very low vibration, this undertone in the fork. I was using, I think, a 174 hertz, and the low tones, like the low harmonics, kept showing up, which is basically a drop in life force. And I kept saying, "What's going on?" And he's like, "Nothing." I was like, okay. So I just keep working on it. And I was like, nope, something really did happen to you at 52. And he said, nope. And we ended up the session like in Discord. And I was like, no, something really didn't happen. And then he emailed me 2 weeks later and said, oh my gosh, that was the last day I saw my mom alive in the hospital in a wheelchair. And I was leaving her knowing the possibility that was going to be the last time I saw her before my brother came in and took over. And he said, can we work some more? So that was the day I began to really trust what the body is communicating, So some other examples are, there was a man who came in and he just radiated anger from all over. And of course, we know in acupuncture that the liver gallbladder circuit is anger. But for him, it was very, very deep, and it stemmed from child abuse. And he refused to go to his family reunions. Refused. And about 3 sessions, we worked on this, letting this go. And there were cords and attachments and some heavy energy. We pulled off that. We cleared up the liver, we cleared up the gallbladder, cleared up the mind a little bit, actually, because there was some mental programming there as well. And he called me and said, I think I'm going to go to my reunion. And I was like, I just cried, because that's life-changing. So there's some other examples I could give if you'd like. I'll give you my example. I'll give you my example. So when I had my first session a very long time ago, by a very inexperienced person. She was a student as well. And at the time, 2 years of really struggling with my son, who's now 21, with he had a lot of anger, a lot of dissonance, a lot of heavy heart. And he was really getting into drugs pretty bad. I was paralyzed in fear. Paralyzed. I would go in my closet and I would cry because I knew something was wrong with my son, and I was terrified to make the decision to help him. Terrified. So that's where it comes, paralyzed with fear. And so when I had this experience with this sound treatment, I don't know, I guess this was like 8 years ago, the sound treatment, it was on my right foot, which sounds very unprofound. But it was all about making decisions and moving forward. We're moving forward when we step, the energy body. We're moving forward. We're making decisions. We're overcoming. And I went home, and all of the things with my son had heightened to a level of it was life or death, because he had He had actually taken his car, and he had done drugs, and he was exhausted from being, I think, on speed for a couple of days. And he pulled up with his car into a very busy intersection, and thankfully put it in park, and he fell asleep with the car running. And that it was like a couple of weeks later. Sorry, it wasn't even a week later after the sound treatment. And that night I called a boarding school and I said, you guys have some very large Samoans to come get this son of mine and take him to this boarding school for a year? And they said yes. And I never looked back. There was not 1 ounce of fear. It was complete determination and driven and knowing what's right to do in the moment. And it wasn't until like 6 or 7 months later that I went, whoa, that's what that was. That was the change. We were letting go of fear of making decisions in my field. And to this day, he will tell you that it is the best decision that I've ever had, that I've ever done. And so for me, I see profound things all the time. And these little nuances, these little subtle changes become not so subtle over time. It's like when the airplane changes 1 degree and it goes for miles and miles and miles and miles, it's going to be in a completely different place. So that's how the energy field stores information, informs the body, and then the physical body is the last to manifest the information. So we make adjustments out in the field and we create resonance where there's dissonance with sound. There's a couple of things that happen. Number one, the energy field becomes brighter and clearer. We become this beautiful gold ball of light. Number two, we're working towards syntropy in the body. We're working towards less chaos. Number three, the information that's informing our body is turned down, sometimes even neutralized. So we're not being screamed at by our past in making decisions. The last is the most important, which is when we become whole, there's peace, and we can make decisions from there and not from all of the energy of the past. And over time, it's profound. It's profound. I've seen amazing things happen to people. And whether that's their thyroid levels come up, their liver enzymes go down. I've worked on concussions a bajillion times. I've worked on near-death experiences. And it's endless. It's the only limit to sound therapy is my imagination. That is the only limit. So I had this cardiologist one time in my class, and I was like, this is crazy. Let's try this. And I said, hey, we're going to listen to the 4 chambers of your heart. And he's like, okay. So I said, I was running my tuning fork. I was running my tuning fork with my hockey puck, and I'm hitting and I'm bouncing sound off with my intention. I'm connecting to the 4 chambers of the heart, the sinoatrial node, the coronary arteries, and we're listening to each spot in the heart. And I said, now, we've listened to everything. What's our assessment? And he goes, the left chamber of the heart is very low. And I said, I agree. And he said, I have left ventricular hypertrophy. And I was like, and there you go. I said, so let's go find where that started. Where is it generational? Do we need to work generational? Do we need to work when you were a young child? So we go and find those dissonant places in the field and clear them. And so then when it's cleared, like I said, that part of the body has new information, clear information to work with. So there's clearing the stuck energy. 7 C-sections. There's clearing the stuck energy. And then there's also, what do we want to replace that energy with? What do we want to replace? So I do a lot of work with, hey, we've just removed a ton of sorrow, even depression off your heart. What would you like to create in the future? And so we connect with what they would like to have happen. What's their happy end result in the future? And bring in their sound. When they're thinking of it, you can hear the sound change. And we bring that into the heart. And so it's not just neutral, but it's upgraded, or into the throat, et cetera, et cetera. So that's been my experience. And, even the sound of lime has a different sound than Epstein-Barr. Even the sound of mercury has a different sound than aluminum. And you can hear it in the body. You can hear places that are quite heavy. And so using the sound, it's kind of like homeopathy, but different. It's just frequency. In different places of the body, like different frequencies. We know this. The solfeggio frequencies are fantastic. And then one of my favorite places to work actually is in the pituitary and pineal gland of the body, the amygdala, the hippocampus, and things like that. They're just so critical to communicating with the rest of the body. So I think we're all children and grandchildren of war. So we're all coming into this life with some level of PTSD, and our mental body is just like, And so when we can tone that down and we can create neutrality, even if it's a percentage, you begin to have clarity of mind, have peace of mind. So you can show up to your relationships, you can show up to your employee or your employer or your business and begin and come at it from a neutral space, So you can find concussions in the field. Ooh, those are rough. You can find anything. You can find anything that they've experienced. You can find it in the field and clear it. And so it doesn't have that information to work with anymore. So it changes. Things change. And I'm a completely different person. And I think I have a little bit of an advantage because I work in sound all day long. And so my body has been just like over and over, right, of this resonant frequency. And one day I was sitting with I have it right here. I have my pineal gland fork. So it's super high. It's like 4,000 and something. I was sitting there holding this frequency and I just love it. It feels like the angels to me. It feels like an angelic choir. And I was holding it here and then I put it down and I sat down and just sort of, I can feel vibrations. I can, see, feel. And all of a sudden my pineal gland cracked. I don't know if you've ever experienced that, but I was assessing myself for a stroke. I was like, ow, I don't know what that was. That's really, really ow. And I had this rush of hormones and this flush of energy. And it was really painful. But what I realized what was happening is that the sound was healing that part of my body. And I was very grateful because then I was able to even see more. So it's been a weird ride, a beautiful ride. And I often connect very clearly to people's loved ones or angels. And I have felt them moving. I've felt them moving my tuning fork where I needed to go if I wasn't in the right spot for that person at that day. I've literally I'm not moving this fork. It's moving over here. Okay, I guess we're going to work over here right now. And the more I honor that and the more I listen and trust, the faster this has just blossomed into something that I really wasn't expecting. But it still fits in the bucket of what's a stealer and what's a donor of energy. It still fits in that bucket. So tuning the body is just, it's my favorite thing. I'd much rather go, I'd much rather go back 17 generations and find out where their hematochromatosis or their hemochromatosis started. Mm-hmm. I just think that's, and then you work your way in and then you work your way through them and wherever it began, whether it was a, bone marrow or whatever. And so I've seen lots of different things change. And I've been very blessed in that regard. And I've also been very blessed because Dr. Tennant just cuts me loose. He cuts me loose. So I'll make a homeopathic frequency for them using, the Guardian or, their urine or saliva or something like that. And I'll use that in the field with sound because it'll clear faster sometimes when you're dealing with infections or I'll take mercury and use it as a homeopathic out in the field. And people will tell me their pee smells different the next day because we were focused on getting rid of mercury, in the mouth and stuff that's been already removed, et cetera. So probably need to do some studies. I haven't done that yet. Been a little busy, but this is there. There are many. There's a Biofield Institute, I think, that they've done beautiful sound work, and have plenty of information. Mine is just a little bit more. I think I walk between the worlds a little bit, so I can see a few different things. But sound itself is probably one of the first healing modalities that there ever is, whether it's coming from your own voice or a tuning fork. So, and I guess I'll close because I know we don't have time. Oh, wow, I went over. I'll close, but you know, we must find out where we hold our fear. And sometimes it's all over, because I've found that fear is the great separator. It's the great separator between us and our creator. It's the great separator between us and our path. So being able to find that and release it is really important for us as humans, as we begin to expand, as our consciousness rises up, as the world begins to heal, as we create a new world. We need a lot of consciously awake people who are ready to make uplifting and decisions that better humanity. So that's my work.
Hey, Dr. Amy, it's amazing. And I'm going to just give you a plug, because I have four children from 35 to 18. And I won't mention any names, but 3 of them must see you. 3 of them must see you. And one, I don't want to give it away in case they watch this, but I'll send this along. But I was having a conversation with my son yesterday. He's 28, the optometrist, and I'm going up to Mass in Connecticut. I live in Tennessee on Memorial Day to help my daughter, who just bought a house, build a chicken coop, and my son do some renovations. And for various reasons, both of them want to do their own work. But I was explaining to my son exactly what you said about construction. If you want to do a good renovation, you have to eliminate the fear of the destruction and rebuilding. You know, like taking down that wall, you can't pussyfoot. You get your sledgehammer out and you take down that wall. First, you want to make sure the structures around it are adequately supported. But I said, fear. I think the difference between the layperson and the professional doing it is the professional has done it so many times, they have no fear. They know what to do, and boom, they just do it. And so anyway, you know, not health, but it was just interesting. We were talking about that 10 o'clock Eastern last night. But I have a couple questions for you. Mm-hmm. Epstein-Barr, I don't test it that often. Many times it's up. Do you consider it in the same class that even if the IgG is up, it's there? That's all I need to know. How did you, when you saw all the spirochetes wiggling around, how did you treat them?
How did I what?
How was it? How were they treated?
So we did homeopathy. I chose homeopathy as my mode of delivery, and it's really basically maintaining my oxygen levels, my voltage. That keeps them down. I don't know that you can get rid of them completely. I don't think
you can control them. That's what we need.
You can control them, right. And I like to work on the resonance that they carry in the body.
Yep. There's a gentleman in Palm Beach that does a lot of this work too. I met him through Lee Cowden and his group. Oh yeah. But the question is, many people, the number 6 surgery in America is gallbladder surgery. How does that impact energy pathways? Because you mentioned the liver gallbladder pathway.
So aside from doing digestive enzymes for the rest of your life, so if you had the gallbladder surgery of olden times, where you have the big huge scar, then you're looking at like stomach circuit and maybe even and the liver, of course, the liver circuit as well, and gallbladder, and that will create discord in those particular circuits, the stomach and the gallbladder and the liver. And then if you did it endoscopically, you're gonna be looking at the poke holes, and then the very large poke hole in the umbilicus, which is our first scar. And so dealing with the first scar sometimes becomes more important when you've had endoscopic surgery.
Mm-hmm. Mm-hmm. Excellent. Toxoplasma gondii, any experience with that?
No, wait, which one?
Toxoplasma gondii.
Yeah, it's not, I have it in my cabinet. It's not a common.
You're looking at someone with IgG.
Okay. Yeah. So what I would do is I would listen to your body, find out where you're holding it, and figure out what's connected to it, and probably pull the homeopathic in and treat it.
So the problem now is, I said 3 out of 4, but we just now made it 4 out of 5. Family members need to come see you. COVID and thyroid. What have you seen? What has been the ramifications, manifestations of COVID, and the kinds of things you've seen in the clinic? What has increased?
So to me, COVID feels a bit more, well, I could say universal, because the cytokines and the inflammation is really everywhere. So I don't know. I mean, with thyroid particularly, it's a dip. It's a dip in energy. When I had it, when I had COVID back in June of last year, I was on the floor here, and I was in devastating pain from just muscle. I didn't have a cough. I had a fever and pain and fatigue. And I actually hooked myself up to my Spooky 2 and ran the frequency of ivermectin for 3 days. I got up and got on a plane and sang in a choir concert. And then my hair fell out. So I think my thyroid and my hair are super connected. So I knew my thyroid just got slammed.
Mm-hmm.
Slammed.
And now we'll go through some questions. Who did the study homeopathy study with? Or
who did I study homeopathy with?
What was the question? Who did you study homeopathy with, and also for using tuning forks the way that you do?
So that's an evolution. I worked with homeopathy with Dr. Tennant, of course. We do a lot in the clinic. When I did my low dose immunotherapy training, there was, it's mostly about viruses actually, and bacteria and things like that, not traditional homeopathy. So it's more geared toward infection. So I learned there. And then of course that just blossomed out into other things for homeopathy. Like I'll make homeopathies for medications that people have had allergic reactions to, et cetera.
Now you gave me your address, phone number, cell home, and on your resume. What can I give the audience, because they like people are interested in? Sure.
So my website is dramymarshall.com with 2 L's. And my email is dramymarshall@gmail.com. And most of I think I saw something about, virtual. Yes. I work all over the world, and because energy does not know time or space. So working remotely is easy to do. I just, I do that all the time.
Yeah. Energy just is dependent on frequency. That's it.
Yeah. It's just the field.
E equals H nu. Very simple. And we thank Max Planck, who famously said, when it comes to COVID and everything that's going on, change in science happens one funeral at a time.
Oh, yes.
He's famously known for that quote. If I've misquoted somebody, but I saw that attributed.
It's so hard to change all that.
Yeah.
There's a lot of funding.
Let's see. So we got that. Imagine a world. Andrew, according to my mentor, Dr. Trump, if we suddenly shut down standard of care medicine and all the financial intertwinings, our country would go into a financial crisis. So Dr. Amy's work is dangerous to our financial security until we can slowly migrate out of it. It's just like a chronic disease. We've migrated into this thing since Flexnor and before for 110 years, and we're going to have to migrate out of it slowly, unfortunately. That's why I'm glad I have a son who can carry on my work, hopefully. So anyway, there you go. You can't deny data or statistics.
I kind of laugh when I watch her because I just think of her. I imagine her when you look at people, you probably hear a sound now, or just even all of us on the call, everyone carries this sound. And there's a guy, he goes, I think his name is Rasmus Goff Berghausen, and he talks about how the HRV plays music. And if you look at it on the sinusoidal kind of a graph of it, the healthier you are, at least my interpretation of it, kind of the better that music sounds, or the more beautiful the music is. And I'm kind of wondering if you have a take on this HRV. And I my own theory is that when we're around people, we pick up on their HRV, we match it, so then we feel their emotion, and perhaps that plays into how it's stored in the energy field. I'm kind of curious to hear your take on HRV and how that plays into the energy field.
So let me know which an acronym, which HRV, which describe that one for me, so I make sure I know what you're talking about.
Heart rate variability.
Oh yeah.
So just go ahead.
Yeah. Heart rate variability, absolutely. So actually, I've seen some interesting things. I had one of Dr. Tennant's best friends came in the clinic, and he had COVID really bad, and he denied a ventilator, and they put him in a room to die essentially. And we snuck in some medications. Okay. So, and then he came to the clinic, and we had the pulse ox on his hand. And I was actually working on his lungs because he was still struggling with long haul. So with the sound, and I watched him, and he's watching as his pulse ox comes up and his heart rate slows down. And I was like, wow, that's significant. And the next day he was breathing better. His color was better. So that's one experience. With the heart rate, what's so interesting about the thyroid is that it is the shamanic gateway between the third eye and the heart. And so the energy communicating between the two, this is one of the pathways. Of course, this is the other pathway. But the communication here is vital. If we've come in with a mission and it's embedded deep in our heart, and we have to figure out a way to bring that to the world and create it from nothing, we've got to use this for vision space to create it. So if the energy between the heart is congested because we've got a rope around our neck, or some institution has shut us down as a child, that is difficult. It's like working through tar. So heart rate variability is one of the things that's easy to measure when you're working on the heart, or working really anywhere else in the body, because you're creating coherence so that everything talks to it, the body communicates with ease. And so it has a beautiful impact on heart rate variability.
I'm going to make one last comment. Then I'm going to ask Dr. Harshfield, who invited you to be part of this today, to come on and make a final comment. But here's Dr. Tennant's book. And you can see I took a few notes. I've read it a couple times. And then in the back, I'm sure I have some too. But what's interesting when you read the book, which is not insubstantial, there's a lot of discussion about biology and physiology as well. And so the reason why I'm making this comment is the lady said her husband has pancreatic cancer. You got to look at health as the multifactorial, the onion. And the first thing to look at is oral health. I mean,
Absolutely.
Pancreatic cancer was shown to be titrated to oral pathogens by Harvard and Brown back 15, 20 years ago. So any bad teeth with him, boom, they've got to go. You've got to treat it properly, whether you go Amy's way, homeopathy, or other ways. You have to start that first, because, just like with a cytokine storm, if you don't take care of it, you can take care of the virus, but if you don't take care of the manifestations of it, you're not going to get better. And the same, I think, with what you're doing, Amy. You've got to fix the physiology as well as find out where things are wrong specifically and retune that. And with you agree somewhat?
I do. Yeah, absolutely. I think, on the physical plane, we've talked about all these different modalities that need to be addressed. And then there's also the emotional, mental, and spiritual plane. So there's many things, there's curing and healing.
Right.
And they're not one and the same.
Right.
So absolutely. The dental piece is my biggest, if I could,
healing is voltage. About 80% of what he talks about here is physiological.
Yeah, it's all, and we really have to honor physics here. I should have been a physicist. I know this now. But we really have to honor physics in the body, and it's not just, it's not just molecules.
And with that, Dr. Harshfield, you want to pop in and add a final comment?
Amy, good to see you again, my dear.
Good to see you, Dr. Harshfield. You have a piece of my heart.
This is an interesting group, this community. We call them citizen scientists, and it includes all of us. A lot of times we, and particularly me, getting stuck in allopathic channels, I look at one little dot on a blip on a graph. A lot of these folks come in with a thyroid issue. How do you start? I mean, in other words, we've got a thyroid function. They've got some other lab values that are not quite right. How do you start with someone that comes in? It's almost like that's the canary in the cave more than the problem. I mean, how do you work your way out? This is a big question here, but if a person comes in, I got a thyroid issue, what would you do?
So we have to get the right studies. You have to find out if it's, you need to reverse T3, free T3 ratio. You need to know if it's autoimmune or not. And then begin to address, if it depends on which way they want to go. If they want to try to go natural and not do medications, then they're going to have to slowly up their iodine levels and take fluoride out of their water. To me, that would be step one. That's like the most natural way of healing the thyroid. And of course, energy work. Number two, if they are, I was a single mom and my thyroid was, ugh. So I needed to get on medication right away so I could continue to do what I needed to do. So and I always use natural desiccated. And if they've got autoimmune, I will usually compound a T3, T4 for them so that they don't have that component with the proteins. And then support their adrenals with ashwagandha and holy basil and rhodiola and things like that. And teach them like the Wim Hof method of like cold, to teach them the Wim Hof method of breathing. So that because people want to feel empowered to do their own healing as much as they can. So I do a lot of teaching. I mean, yeah, I can write you a prescription, but I'd rather you go get the fluoride out of your water. I'd rather let's work on your iodine levels and some thyroid support. Does that answer your question, Dr. Harshfield?
It does. That's a great pathway to start.
We're going to have to end now, but Dr. Amy, you've graciously agreed to come back at 7 p.m. your time, 8 p.m. our time tomorrow night. So those of you, I know that there's a lot of information here. We'll get a lot of repeat individuals who really want to immerse in what you're doing. So
could I ask one super quick question of Dr. Amy? Your email, is it on your website? There's .com, there's protonmail.com, and I thought you mentioned Gmail. Which is the best way to reach you via email?
Yeah, so dramymarshall@gmail.com. And okay. I do group sessions, by the way, once a month. I'm going to be starting those up again. So even just sitting in your home and drinking a glass of lemonade in a quiet space, we can get some work done for you. So I offer those as well. And those will be coming up on my website as well as my classes and other things that I offer.
Excellent.
Thank you.
Love it. Thank you, Amy, so much. Blessings.
Thank you, guys. It's a blessing to be here. Thank you, everybody.
Thank you.
Bye.
Thank you.
Hi, Amy. Good seeing you.
Hey.
Thank you. Amy, that's all you want.